A 45-year-old female comes to the physician complaining of excess urination at night. She also complains that she has been drinking more water than usual and has been a lot more tired recently. She denies any recent hospitalization and states that she has always been healthy. She also reports that she has been struggling with her weight and would like to lose some weight. Upon further questioning, she states that her father and uncle both have diabetes. In today's video, we'll be discussing diabetes mellitus, which I'll simply be referring to as diabetes for the rest of the video. We'll also be discussing its causes, symptoms, and treatments. Diabetes is a metabolic disease characterized by chronic high sugar in the blood, which is referred to as hyperglycemia. Typically, after we eat meals high in sugar, it leads to a spike in our blood sugar. But in people with diabetes, this spike is either exaggerated or remains high for much longer than normal, and this is ultimately what leads to all the problems associated with diabetes. There are two main types of diabetes, type 1 and type 2. But in this video, I'll solely focus on type 2. Type 2 diabetes is a form of diabetes whereby your body can't use energy from food properly. In the body, there's an organ referred to as the pancreas. The pancreas produces a hormone known as insulin. The role of insulin is to help the body cells take up the glucose, which is the sugar produced by the breakdown of food. Imagine members of an organization are lined up in a building hallway trying to get into a locked room within the building for work. A key is typically needed to open the door of the room, and if that key is lost, none of the members will be able to get into the room and everyone will start to pile up outside in the building hallway, resulting in frustration. The building hallway in this example is your blood vessel. The members of the organization is your blood sugar, and the building room where the workers are trying to get into are like the cells of your body that require the glucose. And insulin acts as the key required to open the door to let the sugar into these cells. Normally, after we eat a meal high in glucose or sugar, our body breaks the food down, resulting in an increase of sugar in our blood. And this triggers the pancreas to produce and release insulin, which will act as the key that opens various cells of the body to allow the sugar in our blood to move from the blood into these cells. As the sugar moves from the blood into the body cells, the sugar in the blood starts to drop, and this results in a message being sent back to the pancreas to stop the production of more insulin. In individuals with type 2 diabetes, this process malfunctions. The malfunction is a result of the pancreas producing less insulin. Therefore, there are less of the keys required to open the room to let the sugar move from the blood vessels into the body cells. Another process by which the malfunction occurs is due to resistance of the body cells to insulin. This means that over time, the pancreas starts to make a key that no longer fits into the right keyhole, resulting in a key that no longer works, and this results in failure of the sugar to move from the blood vessels into the body cells. In regards to the prevalence of diabetes, diabetes is referred to as an epidemic in the United States because of the high prevalence, with approximately 34 million individuals in the US living with diabetes. This also applies worldwide. Some studies estimate that over 500 million people worldwide are living with diabetes, with nearly 50% of them undiagnosed. In Nigeria, some studies estimate nearly 4 million adults have diabetes, but this number could be an underrepresentation of the true prevalence due to limited nationwide studies. With the continuous urbanization of various parts of Africa, this also leads to a continuous increase in the prevalence of diabetes. At the beginning of the video, I talked about a 45-year-old lady who came to see the physician complaining of excess tiredness and increased urination. She has a lot of symptoms associated with diabetes, which include fatigue, excess urination, also referred to as polyuria, excess drinking of fluids, also known as polydipsia. Other symptoms of diabetes include excess eating, known as polyphagia, unexplained weight loss, visual disturbance, poor wound healing, and also increased susceptibility to infections. Diagnosis of diabetes is typically made when a random blood sugar is higher than 200 milligrams per deciliters or 11 millimoles per liters in patients with symptoms of high blood sugar, or at least 2 abnormal fasting blood glucose test results, which are blood sugar higher than 126 milligrams per deciliters or 7 millimoles per liter. But the most accurate test for diagnosing diabetes is known as the hemoglobin A1C test. This blood test measures the average blood glucose level over a period of 8 to 12 weeks. It can be checked at any time, therefore patients don't need to be fasting prior to the test. A hemoglobin A1C greater than or equal to 6.5% indicates diabetes. A level of 5.7 to 6.4% indicates prediabetes, and a level less than 5.7% is typically normal. Type 2 diabetes can occur at any age, but it typically has an onset in individuals over the age of 40. It is typically associated with obesity and also has a genetic component. A child with one diabetic parent has about a 40% lifetime risk of developing type 2 diabetes. Some studies also report a concordance rate of 75% in monozygotic twins. This means that amongst monozygotic twins, if one twin has type 2 diabetes, there is about a 75% chance of the other twin to also have diabetes. Some environmental factors may also render a genetically susceptible person more vulnerable to the disease. For example, an individual that has a family history of diabetes who eats a high-calorie diet and diet high in carbohydrates such as rice, yam, cassava, fufu, bread, etc., and also does not engage in high physical activities can cause the disease to manifest earlier. In regards to management typically involves identifying these risk factors and trying to control what you possibly can. There are some things out of your control, such as the family history of diabetes, but things within your control that can reduce the future risk of diabetes include physical activity, at least 30 minutes per day, 5 days a week, avoiding diets high in sugar, minimizing the consumptions of high carbohydrate food, eating more vegetables and fruits, as well as foods high in fiber, and abstaining from alcohol and smoking. If these fail, other therapies such as oral medication and insulin can be used to help control the blood sugar. It is very important that your blood sugar is adequately managed and followed closely with your physician, as well as monitoring for signs of low blood glucose, which can be very dangerous. Signs of low blood glucose include heart palpitation, which is a feeling that your heart's racing, as well as worsening tiredness and confusion. If you start to feel any of this, immediately check your blood sugar, and if it is low, try to drink something that has sugar in it and immediately let your physician know. It is very important to stay on top of your blood sugar control because chronic blood sugar can lead to damage of almost every organ of the body, including your heart, increasing the risk for heart problems, your kidneys, increasing the risk for kidney failure. It can also affect your eyes, increasing the risk for loss of vision. Chronic high blood sugar can also affect the brain, increasing the risk for stroke, as well as also affecting the immune system, increasing the risk for infection. The constant high blood sugar can also lead to damage of the nerves, resulting in numbness, and can also damage the blood vessels, resulting in poor wound healing, especially worsening foot ulcers. So in summary, diabetes is a condition characterized by chronic high blood sugar. Type 2 diabetes is typically caused by a decrease in the amount of insulin that's produced by the pancreas or resistance of the body's cells to insulin. Type 2 diabetes typically occurs during adulthood and is associated with obesity, and it's also hereditary. Symptoms include fatigue, polyuria, polydipsia, poor wound healing, and management includes addressing the risk factors within your control, such as diet and exercise. If these fail, oral anti-diabetics or insulin can be prescribed by your physician. It is also important to continue to monitor your sugar to ensure it doesn't remain constantly high, as well as monitoring for any symptoms of low blood sugar, and immediately let your physician know if any of these occur. Thank you for watching today's video. Please do leave a comment on how I can improve the video moving forward in the future, as well as any questions you might have. Hope you have a great day. Bye.